name's Dr. Michel A. Woodbury Farina. I am a psychiatrist. My board's in general psychiatry, child psychiatry, and geriatrics psychiatry. I'm a professor at the University of Puerto Rico School of Medicine. And I've been using Alpha-Stim for about 8 years. I think it's really interesting to know how I started with Alpha-Stim. About 8 years ago, I didn't know anything about Alpha-Stim, and an anxious patient, came up to me and he said that he had heard of this technology that is very effective in anxiety, and he wanted to try it, and he needed a prescription for it. So I said, well, okay, never heard of it, but I'm a researcher, and willing to see how it works. And so I wrote the prescription, and he said he was going to use it with his aunt, who was a very depressive person, and I really wished him luck to deal with her depression. So a month went by, and I saw my patient again, and I asked him, well, did you get the device? He said, yes. And he said that he had made a huge mistake. What's the mistake? He says, I put it on all my friends, and they all really liked it. They all felt very relaxed. It seems like I have a lot of anxious friends, and they want to use it to deal with their anxiety. And I'm, okay, but how about your aunt? We went out last night, and she was really relaxed and talked up a storm. Oh my God! So I told my wife, get that device. I want to see what it's like. So I started using it and was very impressed with how fast, especially, it decreases anxiety. I can have someone in a panic attack, almost 9 or 10 out of 10 in anxiety, and I can put it on their earlobes, and as soon as they get a sensation of floating, the anxiety is gone down to 0. And that is a very consistent response. There's a problem in Puerto Rico. We don't have insurance coverage, so I have very few patients buy it. But practically all the patients I see, I put on Alpha-Stim during the session, and they feel very relaxed, and I can go into, let's say, a very anxiety-provoking subjects, and they're calm. They're very calm. So it really helps me to dare to go into areas in which I might be loath to go into because of their anxiety. Depression, what I've seen is that in these sessions, let's say I've had people cry, even with the Alpha-Stim, but it's a calm crying. They recover quickly. I had one patient who was going to go to court and was possibly going to have to put her ex-husband in jail because of not paying child support. So I had a session with her of Alpha-Stim, and she was very relaxed. Went to court, almost got him in jail, cried her eyes out, but she said she was calm. It was like a calm crying. So obviously depression takes more time. It's not a magic bullet, an immediate magic bullet for depression, so it has to be done every day. I published one case where I did give 1 hour a day, once a week for 6 weeks, and that person basically had an excellent response. She was even an ex-addict on methadone. She did very well on Prozac, and she came out of her depression. So also when they have sleep problems, I always tell the patients to try to remember how they sleep that night, and especially those who buy it. The most common comment I get is that they sleep much better, much deeper sleep. Of course, the theory is that if we increase the neurotransmitters during the day, when there's that, with the Alpha-Stim, when there's that decrease at night, that's when they can go to sleep, which is why it's not recommended that you use it before you sleep. It's usually during the day. But the ones who buy it, I have some who use it before they go to sleep, and they go to sleep. Others, they use it before they go to sleep, they don't sleep. So it's not a black and white. But again, I hear a lot of people sleep much better on using the Alpha-Stim every day. The also it's something that's not yet known in Puerto Rico, and so what I do is that since I'm a professor, I put it on all my medical students. So at least every graduating class at the University of Puerto Rico has had experience with Alpha-Stim, and they'll really like it. They'll tell me that they feel really relaxed, and they many are interested in finding out how they can get it, and they're very intrigued, very positive. And so I'm hoping that the medical profession will, at least some, will know it exists, because most people don't know it exists. Not many psychiatrists in Puerto Rico use it, and that's a shame, because I would say it's one of the interventions that's had the biggest impact in my practice. The ones who do buy it, even that patient, that initial patient, once in the therapy session, I said, "Well, how's your anxiety?" He says, "Oh, it's high." I said, "Have you used the Alpha-Stim?" "Oh, shoot. Yes, I've forgotten to use it." So it's something that does have to be used every day. There is a tendency that if you do use it every day, after about 3 or 4 weeks, you don't have to use it every day. It seems to be a buildup. And that what people like is that it is FDA approved, and it's not infomercial, and approved for anxiety, depression, insomnia, and pain. And that's why I tell them, it's like taking a Prozac, Xanax, Ambien, and ibuprofen. Those are other medications indicated for the same problems all at once. So it's a really versatile intervention, and there are lots of studies done and show that the various neurotransmitters increase. Also, you go into a meditative state. You go into alpha, and the intensity of the alpha waves, it compares to advanced meditators, which take usually 7 to 10 years to reach. And I had one patient complain that yes, it took her 7 to 10 years to reach that same meditative state that took her about 10 seconds to reach. And so it is an incredible relaxing feeling. Interestingly enough, there is a float where if the person floats too much, they can't concentrate in the therapy session. So usually the float I see as really calming yourself down, but if you really want to concentrate, I have to go a little bit lower, so they're not floating so much, and they can concentrate. And they concentrate very well. I can tell much better eye contact. They're much more attentive to what I'm saying. They're much more verbal. And so it's things in which you associate with a decrease of anxiety. They're much calmer. And so, because we know that anxiety interferes with your capacity to think. And so that's very well known. And so this decreasing the anxiety is going to help you concentrate much better. Again, the depression, those who are depressed feel a lot better. And so in the sense of anxiety, you're going to feel much calmer. Now, if there's an issue that they need to talk about that's sad, it's not going to totally neutralize the sadness. The sadness will come up. And I'm going to be testing whether the daily use of it really does help depression. I'm going to be the PI coordinating a study on the use of Alpha-Stim with major depressive people. I have a lot of experience with phase 3 trials with pharmaceuticals. I'm running one right now on Alzheimer's, so I'm using my expertise to try and get enough patients to test Alpha-Stim in depression. Interesting enough, the placebo, we call it sham in the sense, and what it is that we have the Alpha-Stim in a very low dose, which if it were on, it wouldn't be felt. And half the people will have that Alpha-Stim on, and they'll be getting that 100 microamps, and the others will have it off. And so they don't know. We don't know which one. I'm not going to know. They're not going to know. It's going to be double blind. They call it sham control. So trial, technical RCT, the kind that FDA likes. And also with that stimulation, what most scares people about this technology is the electricity. I tell them, it is controversial. That electricity has been studied for the last like 2,000 years. And the Greeks were using electrical eels to shock and promote some sort of therapeutic change. It's really been studied a lot since the 50s, and this technology has been since like the early 80s, and it's really different from the other ones. And in the hertz and the stimulation, and it's microamps, but to understand how mild it is, first of all, it's two 1.5 volt batteries, so you have 3 volts. And what comes out is less than, I think it's almost 1,000ths of a volt. So it's nothing. So you might feel a little twitch. Apparently the twitch helps to open the channel so the wave can go through. But that's it. Just feel twitch. And interesting enough, if you open and close the clips, the twitch, the feeling goes away. And I put it on whether they have earrings or not. So I haven't found it's a problem. And the patients usually tolerate it very well. And they like the relaxation that they feel. And many times that's enough to get them interested. Things in Puerto Rico, there's no insurance coverage, and people are not so well off as here in the States, and we're having economic crisis. And I kiddingly say that the worst side effect is the cost. And it's not cheap. But some save up and they buy it, and now everyone who's bought it is very happy with the results.